Good morning, America. This is Dr. Rick Redalen, the Maverick Doctor. Today I'm not going to be quite so loud and bombastic. I think you get enough of that on television every day. But today I'm going to open up to you a little bit about my personal life. You're probably wondering, how does an elderly, seasoned physician nearing the fall and winter of his life and with not a lot of road ahead, managed to get so passionate about healthcare when he's been doing it for nearly 50 years? I probably have to take you back a little bit. I'm going to take you back to my wife, Lori O'Neill, who passed away a couple years ago at the hands of our healthcare system. And I'm going to try to explain to you a little bit about where I'm coming from and how desperate I know all of you are when you can't get health care today. I've been there. I've done that. Have any of you ever thought what happens when one day you get a call from your loved one and she says to you, "Rick, I want you to go in and be checked for AIDS." And I reply, "Lori, I don't have AIDS." And she said, "I want you to get in and get checked." Lori at the time was living in Westlake, Michigan, where we had lived for the last 2 years. We were traveling between Westlake and St. Paul, where I was trying to get Exit Care going. Exit Care was a software company for patient education. Westlake was the apartment we lived in Michigan, just north of the airport, because Lori worked for Northwest Airlines. We had split up about 3 months earlier, and I wasn't sure why. I still loved Lori. I still cared about her. But when I got this call from her this day, when we haven't spoken for 3 months, it just sent a dagger through my heart. I thought, here I am, having my loved one call me and say, "Rick, get checked for AIDS." And I replied, "Lori, I'll be on the next plane and I will see you in a couple hours." Well, when I arrived in Michigan at the airport, Lori was waiting upstairs for me at the gate I was getting out of, and I just about fell over. Lori had changed so much in only 3 months. This beautiful little gal I know had wasted away immensely, and I thought she looked near death. I said, "Lori, just sit down." I gave her a hug and a kiss, and I said, "Just sit down. I'm going to go get you a wheelchair." And I took Lori and got her down to the next level and out where her pickup was parked and helped her into her pickup. I don't know how she had gotten into it by herself and came to get me, but she did. And so it was obvious when I talked to Lori that Lori indeed had AIDS, and she looked very near death. As it turned out, Lori had gotten blown over by a jet engine about a month earlier, and she didn't stop until she hit a big cement wall. In that process, she completely shattered her right clavicle, and that clavicle fracture probably saved Lori's life because it got her to a hospital. And when in the hospital, they checked her blood work, and indeed, Lori had a CD4 count of 17. The CD4 count is the count of our lymphocytes. We count them to see what our immune system is like. There aren't many people with AIDS that have a CD count of 17 that are still alive. By God's good fortune, God's guidance, and watching over her, Lori was still alive. I got her home to Westlake to our apartment, and we walked into the apartment, and I got Lori sitting down on the couch, and I said, "What's wrong, honey? What happened?" And she told me the story and told me what was going on. And I gave her a big hug and a kiss, and I got down on a knee and said, "Lori, will you marry me?" And she said, "Rick, I can't marry you, I'm broken. And I said, God doesn't make any broken people, Lori. God doesn't make broken people. I said, we're going to get through this. We're going to be okay. And deep in my heart, I felt God would see us through this. And let me tell you, it was very, very difficult. It was a hard time. My next days and weeks and months were, I carried Lori from a couch in our living room where we'd watch TV during the day, and I carried her to her bed at night and laid her down. It was difficult. Every day I was concerned. Every day I was worried. I had a very, very difficult time getting Lori to eat food. She'd say, Rick, can you get me something from the store? And I'd run there. One day I ran back and forth to the store 5 times and couldn't find anything Lori liked. Every time I get home with food, she'd say, Rick, now that doesn't sound very good now. Finally I said, Lori, you got to try to eat something. Let's try to get a little food in you. I can't keep driving to the store all day long. I said, I'll do it as long as you want me to, but we have to get some food into you. And anyway, this is how my trial and tribulation started out, going after the healthcare field a few years ago. I had done so many years before this. I've always tried to make healthcare the dominant thing in my life, sometimes much to the chagrin of people around me. I feel my patients are extremely important. And if you think us doctors don't go home at night, cry about our patients sometimes, you're wrong. I did go home at night and cry about my patients, and I can't tell you sometimes some of the heart-wrenching stories that kept me up talking to God all night long. I think I better quit for a little bit right here, but I'll let you know and try to lead you down this path and let you know what's been happening in my life and how it has happened and how I have gotten here. God bless you. Have a very blessed day.